The U.S. Centers for Disease Control and Hawaii state health officials report a drug-resistant gonorrhea superbug is on the rise in Hawaii. KITV's Denby Fossa reports that almost a fourth of the cultures tested here last year were antibiotic resistant.
To a physician looking through a microscope, gonorrhea looks like this. Since the late 1990s, Hawaii has seen a steady rise in positive culture tests for a super strong antibiotic-resistant gonorrhea. 22% of the gonorrhea culture tests here last year were the drug-resistant Superbug strain, a big jump up from 8% 4 years ago.
Anytime you have resistance growing to any microorganism, it's always a major concern, because then you become limited in the armamentarium you could use to affect that organism.
Researchers believe drug-resistant gonorrhea came to Hawaii first because we're the closest to Asia, where antibiotics are casually and sometimes wrongly used, creating strong resistant organisms. Then superbug gonorrhea spread to the West Coast and across the United States.
And that's a big concern because there's less and less available drugs.
The Centers for Disease Control says the popular ciprofloxacin, popularly known as Cipro, no longer works. The CDC recommends cephalosporin, which is given by injection. Of course, the CDC is concerned that gonorrhea may soon become resistant to the cephalosporin drugs, and there are no new drugs coming down the pike to replace them. Hawaii health officials say drug-resistant gonorrhea is not going to go away, but at-risk residents should be vigilant by getting tested more often and carefully following instructions for the few medications left to treat it. Denby Fossa, KITV4 Island Television News.